Welcome again to another episode of Lounge with Carlos. This is the place where we talk about the things that matter to us the most, things that we take for granted, affect us in a very great way. And today I'm honored to have the founder of Noble Hands Zimbabwe, Mr. Msiarira. We're continuing from where we left off last time on living with albinism. Msiarira, thank you very much for joining.
Yes. Thank you so much, Mr. Carlos. I really appreciate the opportunity to be on your program. Thank you.
It's great to have you. What drew you to Noble Hands Project? How's this journey been for you as a director so far?
The Noble Hands Zimbabwe Trust, yeah, I think it's something that always wanted to help people. And when we embarked on a musical project with the Queen of Batonga in 2018, 2019, thereabout, we wanted to do a concert for the less privileged in our communities here in Blawayo, whereby we would perform and have the gate takings being channeled to the less privileged. But COVID-19 came and we couldn't do the concert. That's when Noble Hands was born, because we still say to ourselves, no, we need to do this. We need to do something now that there's COVID, and even the challenges are now actually getting worse for these people. Yeah, so we formed the organization, engaged the local city council, Blawayo City Council.
What challenges do you face with your organization so far?
First and foremost, like any other organization in the country or all over the world, the issue of funding. Because what we have here is a very, very good program, the Albinism Connect program. It focuses on people with albinism across the country, and it was born out of the Sanitary Way project, where we went to Binga, and we discovered that one of the girls could not come to the workshop that we were having in that district because of the sun and the fact that she didn't have protective clothing. Then that's when we went to a place. We discovered that she couldn't expose herself to the sun because she didn't have hairs, she didn't have long sleeved clothes, she didn't have lotions. So the only time that she could travel, it was during the early in the morning or in the evening, when the sun is set. So that's when the program was initiated. But now, coming back to your question, um, the Albinism Connect itself is a program that really focuses on sustainable development of the people with albinism. It focuses on health issues. It focuses on empowerment programs. It focuses on advocacy issues again. So these are four clusters that are in the project, which really need good funding. That of which, if we manage to get that funding, surely the lives of people with albinism will be improved. Now, the issue of resources is one area, and the issue of mobility is one of the issues that we which is actually slowing us down also, because of some of the places that people with albinism are. We need to go there and see them, and we don't have cars to move about. Whenever we move, we have to hire a car. So it's a very challenging issue for us as an organization. The other issue is about the misconceptions and discrimination that happens at family level, which at most times it cannot be detected unless if neighbors alert us to that effect. We have children who are being kept at home, not going to school, up until you get someone who is 14 years in grade 5. So these are some of the challenges that we have. We need to get to the people that we are trying to help, so that we understand firsthand what is really going on in their livelihoods.
The director of Albinism Connect, Marvelous, last time, she was highlighting to us that children are dropping out of school because of stigma, because of the bullying, the harassment that they go through. What From your experience, where does government stand in terms of monitoring these problems that the children are having? Because I mean, surely it's unacceptable for children to have to drop out of school because of bullying and discrimination and go completely off the radar without the government following up on it.
Yeah, the issue here, we have got a very good Education Act, an amendment which was made in 2019, I think, which encompasses all those things that children must be protected. The government on the ground, though, is still facing a challenge. We are still having these things happening in schools where children are being bullied to a point that they will say, "No, me, I think I don't belong here." They they drop out of school because of stigma and discrimination. And the other issue, there is need for the government actually to roll out programs to educate teachers themselves to be the protectors, the immediate protectors of children,
Mm-hmm.
and in a classroom environment. You know,
Definitely,
so
definitely.
that's the main challenge. And in the rural areas, uh, teachers can only do so much to protect these children. But when they go home, they will travel for 7 kilometers with other children, mocking them, throwing names at them. So that alone really puts a lot of pressure
Mm.
to a point whereby their self-esteem will be very low. Yes, so there is still need for our government to work towards improving the classroom environment, especially for the children with albinism, or I can just say vulnerable children, children with disabilities per se. This really affects their psychology and their mental health in the long run.
Yeah, definitely. Now, just coming back a little bit to the children in the classroom. Again, referencing back to what Marvelous was saying last time, that part of being having albinism is the significant impact on eyesight. What is in place
Yes.
in terms of books and print font for children with albinism for them to be able to manage the schoolwork, the classroom environment? What measures are in place either from government or from you guys as an organization?
Yeah, I'll start with the government. Like I said, I think in Zimbabwe we've got very good policies in terms of documentation. We've got all those things covered in the Education Act, Amendment Act. But on the ground, only a few schools, I think maybe one out of 10, offers those services. And these are schools which are relatively regarded as private schools, where parents come in and put in their input in terms of the needs of their children. But in the rural areas, they are not having it easy because they don't have these large font text. Even imagine in an exam situation, they are trying to read a single sentence and it takes 10 seconds. So most of them they want 10 minutes. Most of them they won't finish the exams, which will really affect their performance in school. Not that they will be poor in terms of school performance, but the fact that they are facing challenges, extra challenges to read. So this is where we need our government to come in and put in measures. For example, allowing school to give extra time to these children so that they also finish the exam papers. The printing of exam papers itself to be printed in large font to make it a mandatory thing. At schools, and bare minimum to have these textbooks at a school being kept per class in case that a child with albinism is transferred to any school. They will get their needs without struggles.
Mm.
Then under the Albinism Connect from our side, we have our inclusive education support program, which focuses on all these aspects. We're looking at the provision of large font textbooks, provision of the use of certain colors on a blackboard, so that the pupils won't be affected by the reflection of those chalks. They don't in a class whereby we have a child with albinism.
Mm.
They have to actually use a color that is favorable to their eyesight so that they can be able to see. and we are focusing on other aspects which entangles into health, like the provision of spectacles, so that their reading capacity will be improved. So what we have here, we are also engaging printers to find out how much can it cost to print textbooks, so that at least we start with primary education, which is the basic foundation of education for a child, so that at least when their primary education is got a good foundation, it won't be much harder for them.
Mm.
So in our program, we are targeting children in grade 1 up to 7, so that their primary education have got a better footing. But when resources permit, we will be going on to secondary education all the way up to university, because education is the only way we can emancipate people with albinism from poverty. Right now, because of these limitations, or the challenges that they face in a classroom environment, it really affects their lives going forward. Because when someone fails the exam, they can't be enrolled in any university. They just have to stay home and hope for the better. So we are really trying our best, though the resources are not really at our disposal, but we are doing what we can with the little that we have.
Mm.
Thank you.
No, I can understand that. It sounds like a mountain to climb, to be honest. When you look at the other countries within the region and maybe globally, to the best of your knowledge, where would you say you stand in terms of awareness of albinism, communications with people with albinism in comparison to other countries within and around you?
Yeah, I think as Noble in Zimbabwe Trust, we are doing extremely well in communicating to people with albinism themselves on a daily basis. We've got WhatsApp groups where we share stories, experiences. We just, it's more like we are now, we have created a community where we converse and share ideas, experiences about what is going on in our day-to-day lives. And on and I take it you are referring to advocacy issues in terms of highlighting issues to do with albinism to other
Yes.
countries on in other platforms, because the world has become a global village through social media and internet.
Mm.
So we are really harnessing that. I'm sure. I don't know, from your own perspective, you have seen the Queen of Atonga, our ambassador for the Albinism Connect. She's always on the albinism issues daily, day in, day out. I've not seen
Mm.
any organization,
Mm.
for example, in Zimbabwe, really pushing issues to do with albinism like what she's doing and what we're doing as Noble Hands Zimbabwe Trust. And I think we're on a good path to really bring out issues to do with albinism to the open. And we're not stopping at that. We are also engaging MPs so that we push on a policy level, so that we have policy level that as policies that are implemented by government to guarantee sustainable health, education, and other things, including empowerment and social participation for people with albinism in
Mm.
the country.
Mm.
On regional level, we have heard from the United Nations Human Rights Commission. They actually have an independent rapporteur for albinism, coming down to the regional, that is the SADC. We've got an action plan, which was also expanded from the national action plan, that is the action plan on albinism 2021 up to 2022. Yeah. So we now have countries coming in to converge and try to address the challenges that people with albinism are facing in SADC, for example, as a region, because we
Mm.
are connected. These the boundaries that we have, they don't limit harm to occur to the next person with albinism in the next country. We have had people coming from all the way from Malawi, DRC, hunting for people with albinism in South Africa, in Zimbabwe, in Zambia. Just in September, I was in Zambia myself, where we were also opening a branch for the albinism connected there. A child was chopped into pieces in the copper mines in Zambia. So these are some of the issues that we feel they need to be addressed at a regional level, because we are interconnected. I'm happy that some countries like Zambia have gone a step further to actually include the enumeration or counting of people with albinism in their country through a national census, which is a platform that can actually bring out 100% accurate data on the terms of in terms of demographics of people with albinism, and the distribution of the people with albinism around the country. Will be able to know where they are found and where they are not.
Mm.
So that's where we also endeavor to see our country going towards, because the reason why they always have these challenges is because the government doesn't know where they are found. So it's difficult for them to actually put resources because they won't know who and where they are going to be distributed to.
Yes.
So I really hope that through our efforts, we are going to have positive results in terms of this initiative of having a national census, which includes the counting of people with albinism, not just people with albinism, but people with disabilities as a whole, so that we know where they are and possibly design mechanisms that will assist in helping them.
Yeah. I'm just going to bring you back a little bit, the issues around the social inclusion, and community awareness. um, when you're working with maybe more remote areas or the generality of communities where people with albinism are being mocked and harassed, bullied, more of social exclusion. Where do you stand, or what efforts have you managed to put across to improve this awareness in the deeper parts of communities, to try and minimize these negative experiences that people are going through?
Well, that's a mammoth task of which we are already on the ground. If you checked out, we in July we did a tour where we were visiting people with albinism in their homes to find out what is really going on. Because before we even administer any type of solution, we need to understand the nature of the problem that these people are facing, and it's uniform to say in those provinces there is poor social inclusion. I mean, there is poor inclusion in terms of developmental programs. They are normally, uh, you know, disregarded as equal members of the society. At one home, we went to Zwimba area where we visited another lady who was saying people are denying her the opportunity to be in positions of influence in that community. She was saying they don't like her to be part of the committees that are there, that community, because of a condition. So it also revolves down to the issue of discrimination.
Mm.
Discrimination happening at family level, discrimination happening at community level, discrimination happening at provincial up to national level. You know, so I'm happy that this is evidence based. You know, people are we need to do more to help people with albinism.
This is the reason why I'm running this platform, running this program, to help organizations like yours, to help people with albinism and many other conditions out there that people don't know about, or people have got minimal exposure to these things. And this helps to create that awareness, to improve that social integration between people in communities. So on my part, I hope what we're doing here is something that is going to be significant in your mammoth task, of reaching communities, of reaching people out there. Now, there's an old saying that beggars don't choose. You're supposed to work with what you have. But I'm going to give you a chance to reach out to the general public, both within your country, regionally, and internationally. If you were given three things to ask for, which would make a significant difference to your cause, or given the choice, what three things would you prioritize the most that you feel would go a long way for your organization?
Looking at our organization, I think the first issue is about resources that enable us to do our work. By resources, I mean We need aids to the work that we're doing. That is, uh, we need a small vehicle that will allow us to move into the communities and meet these people face to face and understanding what they are going through. And and that vehicle will also also be used to ferry those who are sick from the rural areas to Harare, because the challenge that we are facing right now is the issue of mobility. People who are sick are facing challenges to use public transport because of the seriousness of their wounds, those who have cancer. So getting them to Harare, they would have to use maybe trucks. They will be put at the trailer there because the driver would not want to be, to be disturbed or to be affected by the foul smell maybe that will be coming out of the wound. So we need a comfortable vehicle that will allow us to move our patients from point A to B. Number two, we need resources to fund the printing of large font text exercise books, because we believe education is the answer to every problem that we have in terms of the challenges that people with albinism are facing. If someone is educated, is empowered, they are able to actually, they will be able in the long run to look after their own needs, because we need to emancipate people from the dependency mode. But as long as we don't offer them these aids to success, like the issue of spectacles, large font text, actually affording them to go to school and things like that, we will be circling at at the same circle. We will be we won't be going anywhere. So we need to make sure that at the end of the year, we help some people to actually be on themselves, to become self-sustained. And number three, um, we need to things that I'm asking from Zimbabweans right now as it is. I am pleading to Zimbabweans to support us financially, so that we be able to buy lotions, things that we use at the cancer support house where we keep our patients whilst they are receiving treatment. We need things like bandages, wound cleaning materials, beds, feeding for the team and the caregivers that will be giving care to the patients. So these are the three things that are very, very important to us right now as an organization, so that at least we save lives and we improve lives in the same manner, regardless of which group we are looking at, whether the sick or those who are going to school. We need to assist them through intervening in educationally. Those who are sick, we assist them medically, by making sure that we can afford to buy medications, doing medical tests and what have you, so that we don't lose people every month to something that is curable. Thank you.
Mm. Thank you very much for that, Mr. Msiarara. I mean, I follow Marvelous on Twitter, and I saw a message this morning time your side, from Marvelous, which I just, I was really touched, and I felt I needed to say this. I noticed that there is a surgeon who has pledged to treat with people with albinism who've got cancer, and he has offered to do this for free. Is that Dr. Wayne Manana? Is that correct?
Yes, that's Dr. Win Manana. Actually, he started assisting us way back in January from our first patients who some of the doctors were running away from. He accepted us and he was assisting us from that time until now. He's done extremely well. Even he even performed some of the surgeries, because he's a facial surgeon. We are really happy that we have such professionals in our country who are willing to give back to the community and do more to save lives. Dr. Manana is someone who is humble, and he is even actually the surgeries that he does for our patients, he does it for free. Even if they come for reviews, he just do it for free. And I'm very happy that he has really gone to that extra mile to ensure that anyone with albinism who has cancer can visit there, I mean, his place, and get checked out, regardless that they don't have money. So it will go a long way to assist people with albinism
Mm.
and
That's
accessing the health care.
that's
needs.
that's
Yes.
really really that's really really encouraging, and I hope gestures such as are going to go a long way amongst your community, your fellow countrymen, and people within professions to assist in similar
Mm.
causes, and make the job that you do a lot better, make the experiences that people with albinism go through a lot better than what they're having to deal with at the moment. What advice would you give to a couple who are blessed with a child with albinism today? You know, looking at what you guys are doing, looking at what resources are available. This is a very crucial time for them in terms of acceptance of what lies ahead of them, of of what they're dealing with. What advice have you got for them?
First and foremost, I would just want to put out a word out there to parents, especially fathers, who are worryingly leaving their spouses, I mean their wives, because they would have been blessed with a child with albinism. No, I implore to men, let's not do that. Albinism is a natural phenomenon that we have. It's actually normal. Let's embrace albinism. When you are given, when God blesses you with a child with albinism, He has given you something to love. Let's love them. They are such a blessing. Those children are just lovely. I just wish all men would see things the way I see, through my eyes. I mean, when we think we don't know what is really going on, let's seek help. Our organization is on call 24/7. We are happy to assist, to give guidance on how to look after the child, what they need, their needs, and in terms of lotions, heads, and general advice about albinism. We are there to help. This is why we really want to ensure that children with albinism are looked after from birth until they are able to look after themselves, because most children are suffering during childhood because parents would not at times have knowledge of how to look after their baby. So you find some parents using Vaseline on their skin, which actually damages the skin. So even if at a later stage they get to use sun lotions, but the damage would have already been done, the cancer will still come up. So we need to really work together as people of Zimbabwe, and especially fathers, because you are the heads of the families, and we need to be supportive to our wives, especially in cases where we have children with albinism. So
Mm.
I'm asking men out there mostly. I will be hard on men because I've seen it firsthand. I've seen a lot of single mothers with children with albinism, even if they've had some children without albinism before. Once they have a child with albinism, the man suddenly leaves. So it's something that we need to deal with. They children in the albinism grow up in a normal family setup.
Yes. No, that's very true, and that's very powerful. Message like you're saying specifically to men, because we can't leave the partner to deal with this on their own, because at the start of it we were part of that process. So you can't just drop the ball nilly willy when you want, and hit the road. You have to take responsibility of what you started. So yeah, thank you very much for that. And to part off with, what would you say to the community at large? What would be your final words to the general community out there?
First and foremost, I would want to thank Zimbabweans, local and abroad, especially the diasporans, who are funding our activities through the donations that they make from time to time. We would not have reached where we are right now without you guys. You are doing the most. I know some of you are doing 3 jobs, 4 jobs. You are not even getting time to sleep, but you are finding necessary to be donating to this cause. I personally owe it to you that without you we can't go anywhere. I thank you, Zimbabweans, for keeping us afloat, helping people with albinism, especially those with cancer. I don't know what to say. We've got also local, individuals who are coming in to chipping in chipping in to help in a very, very, very big way. One example, we've got one Mr. Murawa in Harare is assisting us with transport to carry, to transport patients from Parenyatwa to Dama Falls and back and forth. Whenever we have hospital runs, is there at any time. So we have got such people in Zimbabwe who are willing to do, more for the vulnerable communities. I really appreciate such efforts. And to the community at large, let's unlearn the uncouth myths and misconceptions about albinism. You don't get rich when you sleep with someone who has albinism. You don't get cured of diseases if you sleep with someone with albinism. You don't run away or change direction when you are passing through, or when you are facing someone with albinism. Those things, they don't exist. They are, let's embrace people with albinism as human beings. There's a person before the condition. I was saddened this other time when a family, our first patient was thrown out of the house during the night, and it was raining because the relatives were saying the wound was stinking and it was now disturbing their peace at home in Marondera. So we need to end such unhumanly behavior as a society. We embrace each other as human beings. Sickness befalls on anyone at any time, and at some point we're going to get sick that will need other people's help. So with those parting words, I think let's be united. Let's stand together with our brothers and sisters with albinism, not just albinism, but even those with other disabilities. They need us. Without us, they will be facing a lot of challenges because they alone, they can't do it. We need to chip in and assist.
That's thank you very much, Mr. Msiarara. That's a powerful message, and a lot of teaching in itself. For the general public and to those who are still finding it hard to to accept albinism, to accept albinism within their communities. And I hope this message really drives into people's minds, into people's character and attitude towards. Thank you very much for being with us. We really appreciate, and I wish you all the best in your endeavors. I wish you all the best in all the plans that you have ahead of you, and I hope and I pray that the community who listen to this message, who've listened to our discussion, find it within them to make some form of support to you. If people want to get in touch with you, how do they get in touch with you if they want to organize some form of donation or support link?
They can contact me directly. My number is 0785 364 700. Wilatem Siarira. Or they can contact Miss Marvelous Chuma on 0783098732, or visit us on our offices in Blawayo 602 York House, Corner 8th Avenue, Ndebe Stepo, Blawayo.
To discriminate is shooting yourself in the foot, because we all have children, we all have nieces and nephews. Today it's not you, but tomorrow it's your child. So you have to create an environment in your society where tolerance is, it's a pillar in your survival, in your everyday life. You have to tolerate other people, you have to accept people for who they are, because tomorrow it can very easily be you on the receiving end. Once again, thank you for watching. This has been an amazing episode of Lounge with Carlos.